And playing pickleball benefit cancer patients? Well, the answer is yes. Hi there, everybody. Jay Harness. I'm the founder of cancerfitness.org, and I'm also the chief medical officer at Maple Tree Cancer Alliance. So let's take a look at this important subject about playing pickleball to benefit cancer patients. Here's a wonderful little publication that came out in a journal, Healthcare, earlier this year, entitled Feasibility, Acceptability, and Outcomes of Project Rally, a pilot study of YMCA-based pickleball program for cancer survivors. It comes from the Department of Health Outcomes and Behavior at Moffitt Cancer Center in Tampa in cooperation with the Suncoast YMCA in Clearwater. The benefits of of exercise for cancer patients are certainly well established, particularly in long-term survivorship. And this is a single-arm pilot study of 21 cancer survivors who were joined by 7 additional family or friends who also participated in the study. When the study was completed, there were 23 participants who did all of the follow-up measurements. The program is structured with sessions conducted at the YMCA that I mentioned, and the sessions were 2 hours per week for 3 to 7 months. And guess what? They used the training done by a certified pickleball coach. The measured outcomes included physical activity levels, social support, quality of life, and stress levels. The participants were evaluated with their physical fitness tests, body mass index, also known as BMI, muscle mass, flexibility, and balance. The data included really high recruitment rates of 90% plus, and retention was 82% plus. And there was strong adherence to the program with 85% plus of the recommended sessions actually attended. Participants rated the program favorably, and they really liked the social support and enjoyment. There was a significant increase in moderate to strenuous physical activity levels and overall improvement in physical strength, as well as aerobic endurance. There was also increase, and I think this is really important, increased companionship and social support for the physical activity. So the conclusion of the study was that Project Rally demonstrated a strong feasibility and acceptability among cancer survivors. Preliminary outcomes suggested that it can enhance physical activity levels, social support, and functional fitness. The study provided a foundation for scaling up the program to reach a broader survivorship population, not only throughout Florida, but across the United States, utilizing community-based YMCA partnerships. Now, this leads us to a really important discussion about exercise oncology programs. I want you to think of them as a continuum of care. The beginning of that continuum is at cancer centers. This includes the newly diagnosed going through prehabilitation, during active treatment, and immediately post-treatment. But then there needs to be continuing physical activity and long-term survivorship. And one of the best locations for this is in the fitness industry. Examples of group fitness program include the YMCA's Living Strong programs, dragon boat racing clubs that have instructors that are trained to work with cancer patients, and more fitness centers and health clubs nationally and internationally are now starting to launch men's and women's survivorship programs with coaches that are trained to work with cancer patients. So there's a lot of really positive momentum going on in this area. Well, as we wrap up, I would like to invite all of you to please join us at cancerfitness.org. We know there that movement is the essence to vitality. We've got all sorts of descriptions of exercise oncology programs, lots of resources of other centers like the Livestrong programs, Maple Tree Cancer Alliance, and others, as well as our posted videos and blogs. So please join us. Jay Harness saying thank you very, very much. Take care now.